So let's get started. But before we do get started, I want to start off with this, okay? This is your workshop, okay? Which means when I ask a question, you're going to answer the question. It's not rhetorical. I really want an answer. Feel free to participate. The more you participate, the better results you'll get. You want to know why? Because if you engage your head and your heart, you're going to have an epic experience in here. Fair enough? All right. Now to begin things, let's start off about me. I'm Dr. Ray. I graduated from Western State Chiropractic College in 1987, where I graduated valedictorian of the class. It made me the smartest of 350 students. It's my brag time. Okay. I was youngest to ever graduate my chiropractic school, youngest to ever be licensed in the state of Colorado, and youngest to ever be appointed to the Colorado Chiropractic Association board. Okay. So with that being said, I got a question. Why is every door in my office 3 foot wide? Any idea? Standard size. Maybe it's wheelchair access. That isn't why I did it. Want to know why I did it? Youngest, brightest, smartest. Are you kidding? My head was so freaking big I couldn't fit anything but doors. It's a joke. You got to explain a joke. It's not that funny. But the whole point is this, though. When I graduated, I was a freaking genius. I knew everything, right? When you're young, you know everything, right? When we get older, we figure out we don't know much of anything, right, Kenneth? That's the problem. Here's what I thought. I thought my job for my patients was to improve their quality of life and make them feel better. So here we go. Ready? Colleen, crack, crack, pop, pop. Feel better? Come back the next time you hurt, okay? What do you think, Kevin? Crack, crack, pop, pop. Come back the next time you hurt. It's a crack and pop, okay? You've heard of them. The Joint, Chiro Now, and most chiropractors. That's all they do. They're treating the symptoms. Okay, so here I am doing my business, crack, crack, pop, pop, crack, crack, pop, pop. People are loving it. I'm doing great. And my first patient walks in. I'm 24 years old, and here's what he says. I got cancer. What should I do? I stopped, pondered, and I said, do exactly what your medical physician says. So they did chemotherapy, radiation, and surgery. Never saw him again. He died. My recommendation, my patient, my heart broke. And I started thinking, I'm not sure I like this. Now, I'll come back to crack and pop, right? Make everybody happy. Crack and pop, crack and pop. And then the next patient walks in. Dr. Ray, I have heart things. They want to crack my chest open and do some stuff on my heart. What should I do? I said, do as the doctor says. They cracked his chest open. They started doing the procedure. He flatlined, never saw him again. I'm not liking these recommendations. My heart's getting destroyed. Third person walks in. Dr. Ray, the doctor says I have diabetes. I have to do insulin shots. What should I do? Tongue in cheek, I said, do as the doctor says. Insulin reaction. He died, and that was the end of it. I said, I'm going to lose my mind. I said, this is crazy. People should not be dying from this stuff. So what I did, because I am smart, bright, young, right? So I went back to school, basically, and relearned a lot of things. I turned my practice on its end. And I changed everything. So we're progressing with this new philosophy of practice, which is wellness. And a patient walks in and says, I heard about your practice from a referral, and I have stage 4 terminal breast cancer so bad, the doctor said nothing could be done. I said, let's get started. So I did the work. She did everything I asked. And guess what? She walks in one day and says, Dr. Ray, all my cancer is gone. And what's interesting, I don't treat cancer. I don't treat cancer. I don't treat diabetes. I don't treat anything. Do you understand what I'm saying here? What we're going to do is restore you. We're going to restore the body back to health. You see, healthy people don't get cancer, right? Healthy people don't get diabetes. So if I can turn your ship around and make you healthy, you're going to have a great thing. Does that make sense? So truly, all we do is one thing. Restore people back to 100% healthy. That's it. Now, what is the opposite of health? What's the opposite, the other end? It's death, okay? But think about this for a second. If the opposite of health is death, that means it's other side, just think of put a word in front of it, life. So what are we really doing for you guys? Restoring your life back. Do you understand? You see, I don't want to see you guys miserable, sick, on oxygen, in colostomy bags, and wheelchairs. When you get old and gray, I'm going to be on a freaking wakeboard when I'm 120. Okay, I'm telling you right now. I'll hopefully still be doing backflips. We'll find out, right? but I'm going to work my fanny off to stay healthy. I'm going to do the same thing for you. So you can do whatever it is for you. Maybe it's climbing Mount Kilimanjaro for you. What do you think? Want to do that? Not really, but maybe. It's whatever you want. That's all that matters to me. Maybe it's sitting playing with your grandchildren. I don't know. It doesn't matter to me as long as you get to do it. Fair? All right, excellent. Now, what is the purpose of a symptom? Go. What's it for?
I'll let you know that there's something.
Boom, she got it. It's a signaling system telling you something's wrong. So next question, are symptoms ever a problem?
It can be.
Never. They are never a problem. I didn't say they were pleasant.
Oh, okay.
They're unpleasant as heck, but they're never a problem. They're a gift. And all they're doing is telling you something's wrong. Something's not working the way it's supposed to. So you're supposed to honor your symptoms. So literally what it's telling you is to do something. It's telling you to stop. Stop in what? Listen to me. I'm telling you something and figure out why I'm not doing well. And what do we do about that in America? Nothing. We go to the grocery store and we take drugs like Advil, Tylenol, Aleve, so we can keep on going, right?
I'm on blood thinner. They took all those away.
but see, but now you're on a blood thinner. But they forgot to ask the important question: why do you need a blood thinner? See, but if we answer that question, you won't need blood thinners anymore. See, that's the point. When you're healthy, you don't need these things. Fair? All right. So. Next one, threshold. Now, two important numbers I want you to remember. Ready? 45 degrees and 60%. Everybody got it? Those are two numbers you will be absolutely tortured with in this office for the rest of your life. Okay? So, what is 60%? That is the threshold of symptoms. Now, remember my word, threshold. Okay? So, if you're over here at 100% healthy, how do you feel? Go.
Fabulous.
I like fabulous, but I'm going to go with great. Okay? Fabulous is better. But we'll go with great for my PowerPoint here, okay? Now, here's the thing. It's a threshold. So if you're at 61%, how do you feel? Ken? If you're at 61%, how do you feel?
Okay.
Just okay? Anybody else got an idea?
Iffy.
Iffy? Ooh, I love Natalie. Everybody listen to her? She listened, right?
Well, I thought 60 was great.
61, just above, right? So you still feel great, right? So remember, think of it like a cliff, all right? If it's 10 steps to the edge of the cliff, the first 9 feel fine, but that last one's a bummer, right? Now, guys, it can be a cliff where like a car accident, a slip and fall, some major catastrophe, or it could be a little hill, and we get mild symptoms. And that's where we go grocery shopping, but not in the tomato and lettuce aisle. It's in that one aisle, right? And you take the drugs, and do the drugs work? Yes or yes? They do their job, which is to mask the symptom, but not address the cause. So if you don't address the cause, the problem gets worse. Now we end up severe, okay? Now we get scared because the symptoms are severe. Now we end up in the office of the medical doctor, okay? 99.999% of the time, what are you going to walk out with? Dominic? Drug prescription, right? For what? To cure or to mask? To mask up the what? You told us, the signaling system to tell you something's wrong. So the problem's going to get worse. It has to, right? So you go to the doctor, you get your drugs, they work, they do exactly what they were intended to do, and then because the problem gets worse, you go back and you say, they quit working. What's he do next? Anybody jump in. Higher dose, or they double down, right? They give you this one and this one. And does it do the job? Absolutely. Until the problem gets worse. Now you go back this time and go, okay, I'm not digging this. So he said, we're going to run a test. Okay? We're going to figure out what's going on. Now remember, how are you feeling? Pretty crappy, right? The doctor runs the test, brings you back in, looks at you and says, well, I ran the test. Nothing's wrong with you. That ever happened to anybody in this room before? Okay, all the hands go up. Isn't that crazy? But here's the thing they forgot to tell you. What the doctor was checking for, guys, was diseases. That's what he should have said. Congratulations, you don't have a disease. How happy would you be you don't have cancer, diabetes, heart disease, whatever? You'd be like, oh my God, that's awesome. But then you'd have a follow-up question he doesn't want to answer, which is what? Then what is it? And you have to say, I don't know, but here's another drug. So instead, you get frustrated and angry. You leave his office and you go get there's nothing wrong with you, sorry. They go out and get the second opinion, right? He runs a test. It comes up negative. And now you're starting to think something is wrong with you. All the experts are saying nothing's wrong with me. It must all be in my head. So what do? You go, I'm going to give it one more chance. I'm just one more guy, and I'm going to go get one more opinion. Except this time the test comes up positive. And he says, I'm sorry, the reason you were having all that back pain, neck pain, chest pain, whatever it was, is because your body was trying to tell you you're getting cancer, you have breast cancer. I'm sorry. Okay? What does he do now? We transition from the management of symptoms into the treatment of disease. Now here's a question. Isn't a disease just a defined cluster of symptoms? Because they just name it based upon this cluster of signs and symptoms. And are symptoms ever a problem? They're not pleasant, but they're never a problem. Because they're just a signal that something's not right. So now we're treating the disease. So they cut out your breast, they give you chemotherapy, radiation surgery, whatever it is. You go back, they look at you and say, we got it all. The cancer's gone. Who's happy the cancer's gone? Everybody. But what did he do for you? See, there's your surgery. What did he do for you? They managed the symptom. And because they never addressed the cause, the problem comes back. What percent of the time? Oh, I made you not, so it comes back 90% of the time. So what did he do for you? He made you not be dead. That's all he did. And now, are you ever going to get out of this system? Are you ever going to escape? No, because it's going to keep coming back and more problems are going to start manifesting and you're going to get sicker and sicker and sicker, not more and more healthy. Do you understand the distinction? And guys, I was doing the same thing, right? Crack, crack, pop, pop. Feel better? Yeah, come back the next time you have a symptom. I'm going to treat your symptom, treat your symptom, treat your symptom. See how embarrassing that is to know that now? So that's a very important question. You ready? And somebody's going to have to answer. Give it your best shot. How do you know when you're healthy? No. How do you know when you're healthy? Now,
Symptoms are over 60.
okay, so this guy feels great at 100%. This guy feels great at 61%. Which one's healthy? Only that one. So here's a question though. If you're in my office and we're doing health restoration and you go from severe to moderate to mild, are you getting healthier going that way? Yes. But the minute the pain goes away, you don't know anymore. So how do you measure it? That's what I'm asking. And it's a hard question because no one's ever posed it to you before. You never even thought of it. And the answer lies in this guy right here, the nervous system, right? Because the definition of health is when your body is functioning at 100%. That means every gland, every cell, every tissue inside of you is working perfectly at 100%. All right? Now listen to this. The body is always talking. The brain is always listening. Then the brain calls in resources. Now all this communication we're talking about comes through the nervous system. So let's use an example. You borrow your wrist. What's this one? Okay, closer. Okay, this wrist is not feeling good at all. It's very unhappy. Okay, it's hurting, it's aching. He hit it with a hammer. I don't know what happened. But what happened? It made a phone call up through that and called the brain and said, I'm dying down here. I need some help. We have a clean nerve. So what happens? The brain says, we'll take care of this, sends electricity out through the spinal cord, through the nerves, pulls in whatever resources are necessary, and heals this wrist. Does that make sense to everybody? And the same thing's true of a heart, a liver, a spleen, a kidney, a colon. It doesn't make any difference because this guy right here knows how to heal. This is the boss, as long as he has a clean messaging machine. Are you following this so far? All right. So now, what is the purpose of spinal bones? What are they for? Anybody?
Extra electric.
That's it. What'd you support? And protection of what? That delicate nervous system. So the armor is what keeps us okay. But the problem is we damage the armor. How do we damage it? Physical trauma to the body, car accidents, falls, sitting in front of computers, picking up boxes, doing what you do for crazy work, okay? Then there's emotional stress, money, jobs, traffic, kids, you name it. We got tons of stress in our lives. And the last one is chemical exposure, alcohol, cigarettes, junk food, medications, things that poison our body. You with me? That damages the nervous system directly. Now, in order for the brain to get a perfect message to the organs and the organs back to the brain, we have to have perfect alignment, which is the magic number. Remember, I hit 60% and 45 degrees. There it is, and there it is. Perfect 45-degree curves. Are you with me on this so far? Okay, now, why 45? Let's make sense of this. Okay, I'm going to pick on you. Ready? Okay, no, you sit right down, it's fine. Take my pretend rubber band. You got it? Now hold on tight, don't snap me. Okay, I'm going to step back. Tell me what happened to the thickness of the rubber band. It thinned out, got skinny, right? Now we're going to come back together, and now we're going to have a 45-degree sag in there. Okay, what happened to the rubber band thickness, Kenneth? It got fat and chubby. You with me? Now let's do it differently. You ready? Now, this is your spinal cord with your beautiful 45-degree curve, which means the cord is fat and chubby. Now hold on tight. We're going to straighten out that neck, straighten out that spine. It's all good. And that you get a thinned out cord. So watch. Check this out. Okay? There it is, the perfect curve. There's the MRI picture with the chubby cord. Now, phase 1, notice there's no curve. Do you see it? So in the absence of a curve, the cord becomes skinny. Now that's kind of hard to see, but look at it from the top view. Normal curve, relaxed with no tension. Look how fat it is. Phase 1, look at the skinny cord. Now can we all agree that cord's about half of the size it should be? Which means the patient by definition is half dead. Okay, you with me? Now this is 10 years of neglect. 10 years of 50% of the body talking to the brain talking to the body, and the body pulling in resources. What's that look like? Sickness, potentially disease. Maybe no symptoms yet, because you haven't broken threshold, right? But you go to the doctor, I feel great. Check me out, doc. Oh my God, we did a breast exam, we found terminal cancer. That can't be, I feel great. See the contradiction? We can put blood pressure cuff on you. You feel great. They call it the silent killer, don't they? High blood pressure, because the nerve is damaged, right? Diabetes, there's so many examples of where you feel great, but you're not healthy, right? So what do we typically do when we have no symptoms? Nothing, right? And then we progress with the tension and stretching on the cord, collapses the discs and ruptures into the cord. We now have 70% damage to the cord, 30% life. Not real good. Tell me the name of the drug that's going to align those bones. And there isn't one, right? Tell me the name of the surgery that's going to align those bones. Same answer. Tell me the name of the place where we're going to get these things lined up properly. Right here. We're not going to crack and pop though, are we? We're going to correct and align based upon your x-rays. Right? There's no guessing. We're going to know exactly how to move the bone. But what do we typically do here? It's easy. We do drugs and surgery. And then we end up here in phase 3. Look at that cord. 90% damage. Scary stuff at that phase. So let's review. Phase 1, when you're looking at your x-rays, too straight. Phase 2 is 15 years of neglect and the disc is collapsing. So you'll see the disc crushing on your x-ray. Phase 3, you got 90% cord damage. I haven't told you yet, but here it is. Let's see how smart you guys are. See you guys figured this out. Okay? Now, point to the good x-ray for me. Good job. It's this one over here, right? See that 45-degree curve? Now, this curve is not only not straight, it's backwards. So we've got to get 10 degrees out of it just to get it to 0, plus another 45. So imagine taking a rope, pulling it straight and rubbing it over the edge of a bone, or in this case, a cliff. What's that going to do to that cord?
Right.
Pretty scary stuff, right? And this is what it looks like on an x-ray. Okay? So if you add all this damage in, see, this is called now degenerative spondylitic osteoarthritis. Everybody together, say that. Ready? 1, 2, 3. Guys, yeah, that's what I always hear when I ask that question. That's why we don't call it that. We call it chicken beaks. Okay, look like a little box on the end, right? So degenerative changes indicate phase 3 damage, which is 25 years of neglect, and a cord that's working about 10%. Get it? All right, so let's look at this lady right here. Now this person right here is Donna. Donna came into the office from a direct referral, as most people end up in here. Okay, no curve in the neck whatsoever, puts her in phase 1, right? Now, the x-ray we just took right here is after 10 years of chiropractic work elsewhere, not here. Did the chiropractor really do his job? Depends what you call his job. He managed his symptoms beautifully. Crack, crack, pop, pop, crack, crack, pop, pop, but did not correct the spine. So Donna, when she first started with this chiropractor, had severe neck pain, but because it never got corrected, developed migraines. Then she starts getting numbness and tingling into her arms. Then she starts burping up acid from reflux because the nerve to her esophagus was broken. And she's starting to develop GERD and she's starting to get scared. Her friend says, this is ridiculous, go see Dr. Ray, refer her in, and she did exactly as I asked, and check it out, before and after. Did I do my job, yes or no? Yeah, but take a look. What went away? All of the signals, all of the symptoms. Why? Because I treated her? No, I restored her. Do you understand? And the body started talking to the brain. The stomach made a phone call through a nerve and said, dude, I'm dying down here. The brain says, no problem, and sends out a signal through this communication network, pulled in the resources, and the gut healed. Make sense? Yes, ma'am.
How long did it take you to?
1 year.
1 year?
1 year. 1 year to get that corrected. And that's pretty typical. 1 year or less. It depends on the person. The real reason, because we're going to learn as we continue through the process, we've got to get the correction done. And correction comes through 6 pieces. Some of you experience for the first day, the correction piece, the adjustment. But then we use vibration technology to lock it in place. Decompression. We're going to have home care. We're going to use orthotics and a pillow to work through that. So how do we get the corrective change? Very simple. Okay? Through what we talk about. So Dr. Ray, what you're trying to tell me is this. All I got to do is show up here, get my chiropractic care, but then I get to eat at McDonald's. I get to sit around and stress out and sit on my fanny and watch reruns of Gilligan's Island and smoke cigarettes and drink booze, and I'm going to be healthy as could be. Who's buying that? Anybody buying that one? Yeah, you wish. Okay? Yeah. The problem is it's not true. Because we have correction pieces and we have resources. And we have to provide both in order to restore the body back to health. You with me? So it's a 5 essential puzzle, right? And we'll talk about each piece.
Well, just don't tell me I can't have Mexican food.
Well, you can we'll talk about that. That's coming. All right. So a little more on the chiropractic piece. All right. We talked about the correction. Now this is where we're talking about orthotics. A dropped arch causes a twisted knee, which causes a twisted hip, which causes a twisted what? Spine. There's your misalignments, right? So this is one of my patients. Look at his x-ray. See the scoliosis curve? Yes? Can you see his leg looks short? It appears short. It's not short. The arch is gone in this foot. This is his photograph. Can you guys see the twisted knee and twisted arch or dropped arch here? Look at the smiling knee and perfect arch. We put in corrective orthotics into the shoes. Look at the difference. See the knee? Because the arch is better. So you align the feet, align the knees, align the hips. Guess what happens? You hold your adjustments when we move them where they're supposed to go. Makes sense, right? Isn't that logical? What else you got to do? You got a pillow. You're going to sleep anyway. You may as well make use of that time. And we're going to mold that curve using a pillow. And it's going to call ligamentous creep and stretch that sucker out and get it back where it's supposed to be. Help mold that 45 degrees. What else you got? Okay. You got some home care. Now the home care is based upon your x-ray. So your home care is different from yours and yours is different from hers. Why? Because you have different patterns of x-ray change. So you'll be doing these things twice daily. Okay? Some of you are going to get spinal decompression. Some of you have crushed discs. See it denting on the nerve right there? So we have to do what's called decompression. We're going to line the bones and open up that disc and suck all the nutrients, stem cells, and regenerate that disc. So instead of degenerating, it's going to start regenerating. You follow that? Okay? Now, not everybody gets everything, but you'll find out when we talk about your program. Okay? Now, nutrition, kind of an important piece, yeah? Now, there's 2 eating plans. We have the anti-inflammatory diet and the core plan here, okay? Everybody, almost, I would say everybody, but 90% start here. This is anti-inflammatory diet. It's going to bring down body inflammation to promote healing. But there's more important things. We talk about the resources, right? So what resources do we need? That's what we need to know. We can't guess, we have to test. So we run urine testing, blood testing, saliva testing. Why? We're looking for all the resources that need to be brought in. If we get the communication right and you don't have resources, you're still not going to heal. So what resources do you need? Well, we're going to test for that. Like you may need CoQ10. Here's a story. You ready? Kevin, you come in, get a perfectly aligned spine. I mean, 45, 45, 45 straight from the front, and you're missing CoQ10. I got a stamp right here. It says heart attack. Ka-chunk, guaranteed. If you're missing CoQ10, you will die from heart disease. Now, would you want me to know that as your doctor? Or would you rather me guess?
I'd rather you know it.
That's what you should probably test for it. Or better yet, you can go to GNC and ask the 18-year-old kid, hey, what should I take? Well, it's on aisle 4, but you CoQ10s. Oh, I know, go to the Sprouts. They have smarter people there. Yeah, but they're still just guessing. There's no testing, right? So we have to test to find out what resources are missing, okay? Fitness, kind of an important chunk, yes? Now, I'm not talking about going to the gym for 6 hours a week or 6 hours a day, 7 days a week. Carol lost 100 pounds 3 days a week, 12 minutes a day. That's called Max T3. That's what we recommend. It's HIIT training, all right? And that's going to bring in another resource called oxygen. And oxygen stimulates the production of energy inside your body and generates a ton of energy. If you're missing oxygen because you sit on your butt too much, you're going to generate a crap ton of toxic buildup and make yourself sick. You got to fix that. Okay? What else we got? Toxins. Do I have to sell anybody on a toxic world? I didn't think so. It's everywhere. We got it, pesticides, herbicides, sodium lauryl sulfates in our toothpaste. You know what it does? It's a foaming agent to make it feel good on your face. But it also causes cancer. Twice a day you're putting that in your face. Every day for the rest of your life. I think we got to know if that's happening. More testing. Find out what toxins are inside your body. And we'll do a detoxification program to make that happen. Fair? All right. What about stem cells? Who's heard of stem cell? Anybody? Okay. Stem cells are basically what our body is before we become us. All right. So picture just a big bowl of goo. All right. When we're conceived, the body will then build a neural tube, which is the beginning of the spinal cord. It starts shooting electrical juice into the stem cells, and we start developing. 9 months later, guess what pops out? A baby. But he's not fully cooked yet. By the time we hit age 20, you have used up 90% of your stem cell population, which means for the rest of your life, you have 10% left. So when you develop the cancer, everybody knows there's cancer cells inside our body, right? How come some people get a cancer condition or disease and other people don't? Because the brain resources, right? Call up to the brain, get cancer in your colon or something. The colon makes a phone call to the brain, calls out to the stem cells, turns these stem cells into immune cells, and you fight cancer. Or when you sprained your ankle when you were 7, or all the other things we do. Make sense? So what occurs is that you start running out of resource of stem cells. So the challenge you've got is we start degenerating. How do you know you're running out of stem cells? Pretty simple. You start getting gray hairs in your beard. You start getting cracks in your face. You start getting those joints on this. I just don't heal like I used to, man. I used to be able to work out. I'm sore for 6 months, right? That's a sign that you're degenerating from stem cell. So what do we need? We need to potentially use platelets or stem cells to regenerate those tissues. Because they're missing, we got to find out. We'll test for that. Okay? What's more important, getting adjusted or why you're getting adjusted? Why? Because guess what? You guys have been maybe you've been to a chiropractor before. And what do you think it was for? I know. Crack, crack, pop, pop, make me feel better. Because that's what you learned from the chiropractor. So here we have seminars every single month. You come to the seminars, you come to the events, you come to our dinners. Why? Because they're part of your program. because we want to teach you so much that you're just over crazy good. I've had patients coming here since I started my wellness practice. Literally 20, 30 years patients have been coming here, and they come to all the events. They're pretty smart people. Sometimes they know more than me. Okay? So what I tell everybody is use those. See, you're a rookie. You're going to come to the seminar and you're going to talk to Mary and Annie and some of the people that have been coming here forever and say, teach me something. And they'll go, okay, and they'll teach you stuff. And then pretty soon you're going to become an expert and you're going to take on the next group and we're going to change the world. Because the whole point here, guys, is this is not out in the world. The only way I know how to do it is what I'm doing now, is just talking and teaching and educating, because it's not out there in the world. All there are is treatment and more. It's called the treatment train, I call it. No more treatment train. Come to the seminars and enjoy it. This is Vicky. She's in phase 2 damage. She came to a seminar on gut. Why'd she come to the seminar on gut? Because her friend told her to come. She came to the seminar and we talked about this thing, and she goes, I want to get checked by this guy. Shows up in the office, and what do? She goes, wait, before you take my x-ray, look right here. She had a big old scar on her chest. You know what it was? I said, bypasses? She said, no, heart transplant. The reason I'm here is because the doctor said the immunosuppressive drugs you're giving me are not working. My heart is dying in my chest. I'm going to be dead in less than a month. What can you do? I said, same thing I always do, make you healthy. So we started working on the communication and the resources, and there she is, all fixed up. 1 year later, still with us today, getting maintenance adjustments. The miracle of the body. That's all it is. This is Asley. See the chicken beaks on the edges right here? She had lady part troubles and colon problems. There's her after. See the beautiful curve? Did the beaks go away? No. Doesn't matter. The tension's off the cord, so the body's communicating the way it's intended. Right? Next x-ray is Asley's, her name, is her husband Norman. Now they came in together as a husband and wife. Okay? And we did the class just like this, went in, looked at the x-rays, and Norman says these words. Oh, Asley said, I'm all in, I'm going. And you saw her x-ray. Norman looks at me and says, listen, I'm busy, I got 2 jobs, I just don't have the time to come in, and it's really tight with money, and now she's doing this, I can't do it. So he listened with his head. He didn't listen with his heart. So he waited 1 year, no intervention. This is his first x-ray. Okay, now check this out. Now, can you guys see the scoliosis? Yes? Okay, now what is this? Anybody know? Back surgery. It's a fusion. Okay, and we asked the question earlier, what's the name of the surgery that aligns the bones? There's your answer. It didn't. What is this? You ready for this? 7 shots of cortisone into the exact same spot. Cortisone's dangerous junk. It dissolves tissue. Yeah, it feels great because it dissolves all the inflammation, but it leaves a gaping hole, which the body put calcium in. The body's smart. So Norman waited 1 year, no intervention. You guys are getting smarter. What's it look like? Has to be. See the twist? Much worse. Look at the cracked and bent rod. Then the doctor put this machine inside of his body. Anybody know what this is called? This is a reservoir of morphine. This is called the morphine pain pump. This pumps morphine into his bloodstream 24 hours a day, 7 days a week, 365 days a year. And what does it fix? Nothing.
Just kind of numbed you.
Exactly. So he's in here treating symptoms. Listen, you guys are getting smarter every day. But look, this is what he did. He comes in and says, it's not working. I'm dying here. I got to get started. And what was he worried about? Money and time. Which one's more expensive to fix, do you think? That one, right? Sadly, this calcium deposit that formed wrapped around his nerve to his prostate. 3 months into care, Norman died from prostate cancer. What would have been different if he'd have started a year ago like his wife? You get it? He would have been okay. I can't judge. I don't know. But all I know is he would have been a healthier guy, and the consequence of that is a lower risk of diseases and cancer. That's all I know. Who's got kids? Raise your hand. Grandkids too? Okay. 13 years old. When would you want to know this is happening to your kid?
As soon as possible.
This is already too late, isn't it? But we took the x-ray, we should get down to business. Can we fix that? Absolutely we can. Mommy got scared. These children die from heart and lung troubles because of the neurologic damage. Within 24 hours, the doctor over at the spine center peeled her meat back, chiseled and hammered this into alignment, stuck rods into her back to line the bone so the nerves would be okay. Here's the scary part. She's 13, which means she's going to do what? Outgrow the rods and probably have to do it again and maybe again and again. I don't know. But you never got the chance. So when should you get your kids checked? Yesterday? Makes sense, yeah? Okay, one more x-ray. Which one's the good one? Point to it. I want to make sure you guys got this dialed in. You got it. Now here's my question. Does it matter to you that this one right here is 6 years old? It's crazy. Do you think he drove here in his car, walked in and said, I'm having terrible migraines and numbness into my arms? He came in because his mom sat through this class and said, I need my family checked. So they did. We found this, and that's him fixed up right here. Beautiful curves. And imagine his life here compared to here. Add 10, 15, 20 years. What do we got? Ritalin, diabetes, heart disease. I mean, how many kids now are sicker and sicker and sicker? And this is the reason why. Versus here. Now he's 120, maybe on a wakeboard with me. I don't know. We'll see. You follow? How many people need to know what you know right now? How many people?
Everyone.
And how are they going to find out, dear? You've got to tell them. You tell them and you tell them and you tell them. But they're not going to listen. You want to know why? Because all they know of chiropractic is crack and pop, right? You need to educate them. So every time you tell somebody, you say, go and get checked and listen to this guy. That's all you got to do. Give them a chance to listen. So family members, check, cost free, no cost to get checked. You bring them in, no cost. Just tell them that you're related and we'll get them all. So the staff will get your family scheduled tonight. Number 2, if you're a guest here tonight supporting a family member or supporting somebody, your x-rays are on me too, no cost. I think it's cool you're supporting somebody tonight. Okay? Third thing, tomorrow when you come back in, you're going to write down the 10 people you love most. And we're going to take them to a dinner over at Tony Roma's Steakhouse. Here's what I know. Pharmaceutical companies have a lot of money. Can we agree with that? If I said raise your hand in the air, if you think drugs are bad, all hands would probably go up. And I said put your hand down if you're not taking a drug, and all the hands would stay up. You want to know why? Because they don't have a choice. What's the choice? You go to a medical doctor, what's he going to do? Drugs. It's what they do. It's not their fault, it's their system, right? So give these people a chance to learn something different. So you write down the 10 people, we take you over to the Tony Roma Steakhouse, I tell a story, and they can listen or they can not listen. It's their choice, but at least they got a chance to hear it.